should I exercise if I have chronic pain? That's what we're going to talk about next. So I want you to consider one thing before I kind of answer this question fully, but let's look at what physical therapy is. So consider going to physical therapy. When you go to physical therapy, this is usually because you have a small pain or injury in the body. When you go to physical therapy, the idea is to do very small movements to kind of build up your overall strength, to build some tissue tolerance into that specific area, and then also to kind of help address that fear and that catastrophizing that we talked about previously in this last portion of the podcast that can greatly influence your overall signals of pain. So when we're thinking about pain and exercise, and should I exercise if I have chronic pain, that's exactly what people are doing when they're going to physical therapy. Physical therapy, although there is some passive modalities, they might do some stretching, they might do a little massage. Physical therapy is exercise. Physical therapy is, however, a very small dose of exercise that usually people can handle within current loads. But this is literally the idea of physical therapy. Going in and doing very small movements at a very, very light load and overall volume to build up that tissue strength, build up that tissue tolerance to get you back up to par. And I really want to not underplay this idea of using physical therapy or just exercise in general for specific movements that hurt or are harmful as a way to address the fear associated with doing specific movements. I, for example, a couple weeks ago actually tweaked my lower back doing a deadlift. And we'll talk about this later in the podcast, but after doing that, I immediately started thinking about the pain. Oh my gosh, what's going wrong? Did I herniate a disc? Did I blow out my spine? There's so much tightness, there's so much pain. And really, that made the pain much worse. So part of the reason we're trying to go to physical therapy or just do exercise in general is to teach your body to realize we can relax. It's okay. Part of it might be biological, but again, a huge part is social. So kind of finishing that story, I actually sat down. I actually just simply felt the pain and just told myself, it's okay. This will get better. Lots of pain does get better over the time because, as we discussed, most of this pain isn't from formal tissue damage. And over time, it went away. Great. That's usually what happens with pain. And that's another thing I want to reiterate when you're having pain with chronic exercise, that most of the time you're having pain, doing some stuff long-term will actually help this tremendously. In addition to this, we can also look at what happens if you don't exercise with chronic pain. Because I think that's kind of a double-edged sword, You might think, oh, there's no good reason to exercise if I'm having pain. Well, there absolutely could be some potential issues. Let's think about the pain itself. If you don't do anything to actively try to fix that pain, the pain may ultimately get a lot worse. Simply because the tissues, the ligaments and tendons and all the things surrounding those pain signals, they're not getting any stimulus, they're not getting any blood flow, so they could be getting weaker, but you're just not training the movement. And as we discussed, training the movement, getting used to doing movements and teaching your body that it's okay, I'm not going to ultimately feel pain when doing this, is a crucial part to lowering that psychological issues that sometimes happens with pain. In addition to this, your health may become worse in other areas. So not addressing the pain directly, but you might have eventually pain in essentially other areas of your body. So let's think about brain health. We know exercise and fitness really helps with cognition, memory, overall brain health and function. Your heart health, the ability to pump blood and have good cardiovascular endurance, that's crucial with exercise. In addition to this, blood sugar regulation, so your body's ability to take glucose and use it as energy in the bloodstream for your body, or take glucose or things you break it down and store it as muscle glycogen that you can use at further dates. That's going to be compromised if you're not formally exercising. In addition to this, depression and anxiety. Sometimes people, when they're actually having lots of chronic pain, their depression and anxiety might be increased a little bit. And actually, shocking enough, exercise helps tremendously with reducing depression and anxiety. So it can kind of indirectly help that as well. Also, last point here, pain may creep into other areas of your body if you're not being diligent in exercising the rest of them. What I mean by this is, say you have knee pain, for example, and you don't ever try to work around that knee pain. You don't ever try to actually make it healthier. You don't ever try to make it stronger and work through it to any degree. You're not proactive. That then can cause you to overcompensate and kind of lean towards one area of your knee and just cause more issues, more imbalances long term for the rest of your body, essentially. So, exercise, if we don't do it with chronic pain, can of course lead to all these different things we just mentioned. So to answer the question of, should I really exercise if I have chronic pain? Yes, but we need to do it in a very smart way. We will address this later in the podcast, actually in this next section, but we shouldn't go from nothing to everything. We shouldn't go, if we have knee pain, for example, from doing no squats at all, no body weight squats, to doing full range of motion, full depth, loading a barbell on your back, body weight squats. That's of course going to get the pain much worse. Instead, there's a lot of good ways to kind of lean yourself into more, I hate to say lower impact, it's not really lower impact, but it's a more manageable stress and workload for your individual.